Okay,
Good.
beautiful. So I want to introduce Nurse Idara. Am I saying that correctly? You can say it.
Nurse, Nurse Idara.
Nurse Idara, the beautiful Nurse Idara.
Hmm.
And you are all the way in New York on the front
Yeah.
line of this COVID-19 fight. We're talking about it every day from my perspective, but you're actually physically there. So what has it been like for you?
As of a week ago, it was different. I remember I posted something on Instagram about a week ago when we got one of our first rule out patients to the hospital. And honestly, in a week and a half, things have changed exponentially.
Mm,
On Monday of last week, we had about 15 positive cases in our hospital. By Friday, our hospital had about 45 positives. And then just over the weekend, by say Monday, Tuesday, we had almost 200. So it's growing. The number of persons that are coming into the hospital who are positive and they need to be hospitalized is growing exponentially. So the hospital is changing every shift. Friday, it was busy. I was taking care of a positive patient, but by Monday, it's just been a crazy journey so far. So everyone is just trying to really find their footing. It's not
right.
that we're not used to being busy. We're used to being busy, but the type of patients that we're getting and the volume and the amount of staff that's needed is what is shifting so quickly, and
Right.
that's what's throwing us off a little bit. So it's been
Man,
interesting. Yeah.
have you guys, been able to take a look and see what is behind the number of the massive explosion? Like you mentioned, it sounded like it doubled and tripled just within
Hmm.
a week.
You know, we've been trying to, hypothesize
Yeah.
because New York has been on lockdown for more than a week,
Right.
or almost 2 weeks at this point. And so the social distancing is already in effect. A lot of businesses are closed. People are working from home. And so as a state, we are really trying to implement social distancing to help flatten the curve. However, I think it just could be the way the virus is set up. It
Yeah.
has that latent period where you can contract the virus. People who contracted it in February may just now be starting to show symptoms, or beginning of March may just now be beginning to show symptoms. People may have been symptomatic, but now the symptoms are just worsening to the point that they can't tolerate certain things at home anymore. And so it could be a variety of reasons, but we surely are feeling the influx at this time.
Yeah, my goodness. We were talking earlier about just how you're seeing these cities where it's more dense population. So you got the Bay Area and San Francisco seeing this explosion. You got New York where people are literally living in these really close common areas together.
Right.
With
Hmm.
this whole social distancing thing, I mean, how do you effectively do it? For me, I haven't been home to see my family since it
Right.
happened. Have some people, everybody's living together. Not everyone has that luxury of being
Right.
able to be separate from their grandparents. So, like, what's the
Right.
best way to go about that?
I think that's what makes New York City so challenging, especially because out of all the cases in the country, we have more than 26,000 in the state as of yesterday, and more than 15,000 of those cases are just in New York City. So at the close quarters of, people are living, families of six in a two-bedroom apartment. Like you said, the elderly can't always be separated from the young or the middle aged, and so it's a challenge that is really it's really not something people have quite figured out. The best advice is thankfully, schools are closed, many universities are closed. And so the younger people are, hopefully, if they're socially responsible, staying at home. But the advice would be that if you could separate from, the young and the old, that would be preferable, because the elderly are just more susceptible to complications. But it's just not everybody's reality. So I think it makes our issue a little bit more intense here because of the social structure.
Right. And the biggest thing we touched on young people, you just mentioned it. When looking at
Yeah.
young people, millennials, when we first heard about this, we thought millennials were not able to get this, and
Yeah.
now someone as young as 20 passing away, and then I heard
Mhm.
babies are getting it. So, like, what's the reality there?
So, in terms of pediatrics, I've reached out to a lot of my pediatric friends. It's been very low numbers for peds patients. I have heard of several infants one or two infants in the DC area who have passed
man.
from exposure to coronavirus, but I believe those children already were had some type of respiratory compromise. So children can be affected. I think for the very young, it's more likely some type of predisposed condition that maybe makes them even more vulnerable. But the whole young people can't get it is not true. I took care of a 19-year-old, a corona positive, a 28-year-old, a 30-year-old, and they were in the hospital. They were critical enough that they needed to be hospitalized. And so, you know, when I saw spring breakers still going on their trips, I understand, you know, you spent money, but I think it's just a social responsibility and not being selfish. You know, one of the issues that people are having is that they can't see the virus, they can't feel the impact of the virus, right? And I understand what that may do psychologically for a person a person who's not medically trained. However, there's consequences to that. You know, there's consequences for being in large groups because at this point we can't see the virus, and so a lot of people are asymptomatic and have it, and they're passing it along, and which is why we always emphasize, we know that there's this thing, people think young people will get it and bounce back, and that's nice, but if I get it and I'm going to a grocery store and I'm touching on the fruit, and then someone's grandma touches that surface, because coronavirus can live on surfaces for hours. And so unsanitized surfaces for hours. So you're touching things, you're being socially careless and not making a big deal. You can affect someone else's loved one, someone else's family member. And so I just tell people, you know, try not to think about yourself in this moment. I know it's hard not to, but it's just best to social distance, at least until your government clears everyone to go back to work. That is our social responsibility.
And excellently put there. For people who are or perceive themselves as being healthy, right? What steps do we need to be taking on our own to make sure that we are not overburdening the healthcare system, right? Do we need to be showing up, ask numbers if I woke up and I feel not so great, or I need to hold there?
So, you know, this is one thing that we are dealing. So, I'm a cardiovascular ICU critical care nurse, so I'm still working full-time in the hospital. I'm also a board certified family nurse practitioner, so I also work part-time as a gastroenterology nurse practitioner. So I've kind of seen how this whole outbreak has affected health systems, both inpatient and outpatient. Our GI office is currently closed. So we're just doing phone consults at this time. So in conjunction to that, I've also seen how it's affected the telemedicine industry. So currently, since I'm not working at the office, I am working as a telemedicine occupational health nurse. And so I'm taking screening calls of people from different employment groups. I think if they contact their employer and say that they're not feeling well, or if they want to call out, that employer has instructed them to call our service to be screened. And so every single day I'm going through a list of symptoms with our patients. And so a lot of people are getting common cold-like symptoms, you know, that may be burdensome. I tell a lot of people that if you're starting to feel very sick, it's best at this time to perceive that you are positive, especially if you have a cough, especially if you have a fever, even if it's only around for one day, and you know, maybe the next day you don't really feel sick. If you have a sporadic onset of any symptoms, for me, if I would be talking to my employer and saying, hey, I think I need to self-isolate, I'm not sure what's going on, because it's a very hard illness to kind of catch. So one thing that has been the issue is that if you're not showing symptoms and you're getting tested, there's a much higher probability of having a false negative. I had a patient, she came in, she didn't have any symptoms. Her husband later tested positive, and then she developed symptoms. And then she came into our hospital because she was in respiratory distress, and she tested positive. So within a 2-week period, she went from being a negative test to being positive. And so the symptomatology is actually really important. And unfortunately, our testing system is not strong enough to test everybody with a cough and a fever, which is why on the phone we say, hey, if you're developed even mild symptoms, it's best to self-isolate. And if you develop shortness of breath or certain critical indicators of an advanced illness, go to the hospital. So
now, we talking about symptoms, and I have seen or heard from people that I've talked to this new kind of symptom that has to do with your taste buds. So, what
Yeah.
are some symptoms you are seeing patients coming and telling you about?
So the common symptoms that have been tested and kind of across the board worldwide is the dry cough,
Okay.
the fever. A lot of times we say fever over, 99.9 or really 100.4 degrees Fahrenheit.
Okay.
So the dry cough, the fever. We're hearing diarrhea is very common in the conjunction with those two. And then the loss of taste and the decreased smell that is coming
Mm,
up in a lot of ENT journals about the decreased smell being a factor and a early symptom of coronavirus contraction. So it's been unexpected. Who would think?
I know.
I can't taste the salt, or I feel congested. And you may not have other symptoms, but that one symptom can be kind of an early sign that you are positive.
A telltale sound. I actually
Yeah.
was talking to a friend of mine who works as an emergency room nurse out in Detroit, and
Mm-hmm.
he has not gotten symptoms back, his test results back yet. But that was one of the things he described: not being able to taste his chicken noodle soup,
Mm-hmm.
and having a headache, and getting sick. So that brings me to
Right.
my next question when we're talking about medical providers. You guys are on the front lines. You guys are exposed to this, immediately
Mm-hmm.
when someone comes in trying to figure out, if they have symptoms or not. So for you guys, what are some of the challenges you're seeing at your hospital? I know across the state there's a mask shortage. I know you and I talked about that. But what are some of the issues that you have to work around every day?
So I think the changing in units, and I think this is one of the points that is kind of emphasized, but maybe it's hard to conceptualize for people who aren't in the inside. I think it's tricky because on the outside, again, you could walk past a hospital and not know anything that's going on. But you have when patients are coming to the hospital, it's because they need hospital level care. A good portion of the patients that are in the hospital are on med surge floors and aren't ventilated. But there's a large population that is rolling in of people who are in what we call the hyperinflammation or hyperinflammatory phase of coronavirus, or stage
Okay.
3, where they are going into respiratory distress, they are going into cardiac failure, and they require critical care beds. Now, your average hospital,
Mm,
or at least I'll speak for my hospital, we have 20 ICU beds. We have, let's see, 6 cardiovascular ICU beds, and we have 8 cardiothoracic ICU beds. So in total, 6, 8, 14, we have about 34 beds in the hospital, right?
not it's for what's
If we
happening.
get 50 people who
Wow.
need to be intubated, what are we going to do? And so
Incredible.
that's been the question. It's like, okay, how do we deal with the volume? Somebody wrote volume, and that's exactly it. It's the volume, and it's the increased exponential pace that people are coming. It's not that we
Right.
have 14 weeks or 3 weeks to troubleshoot
Yeah.
all these things. It's like tomorrow we might need 16 more ICU beds and ICU ventilators. And if we don't have them, what do we do? And
Right.
so departments are being closed. Our cath lab is pretty much only for urgent emergency cases. Our endoscopy unit is being closed, and all types of units all over the hospital are being turned into critical care units. And
Right.
then we're trying to cross-train staff who aren't technically critical care nurses to be able to take care of low, it's just been,
It's been a
it's
lot.
been interesting.
It's been
It's been
over.
interesting.
It's been overwhelming.
It's and the thing about it, unfortunately, is that we haven't hit the peak yet.
Mm.
So
Let's talk
I
about that peak.
yeah, so I respect Governor Cuomo.
Mm.
He has done an excellent job in terms of just exhibiting leadership on how to handle the situation day by day. Again, everybody's learning on the fly. And one of the things he mentioned was that in the next 14 to 21 days, we're going to hit the peak. So we're scrambling now, but in the next 4, we can
Yeah.
need thousands and thousands more ICU beds. And so that is really the part where administrators are really scrambling to figure out what is going to be our strategy.
Yeah.
I'm getting emails recruiting healthcare providers out of retirement. Anybody with a license, come back to work. We need you. So that's the place we're in right now. I think a last challenge outside of trying to adjust to the volume is that, we don't have, again, increase in volume, increase in resource need.
Okay.
We just don't have enough masks. We don't have enough gowns. We're reusing stuff that typically would be disposable. And then we're getting some pushback in administration on, our plea for help. And so it's been a little bit of one of those situations where we just looking towards each other for support. Our teams looking to just support each other the best we can. I have family members mailing me N95s, sending me face shields, just trying to get support from other places if the hospital can't provide it. So.
Exactly. And I feel like just hearing your story, and one, I want to thank you because not only have you worked a long shift, you're on the front lines, you took a moment out of your off time to talk to us and educate us because a lot of people are afraid, a lot of people are worried. So I have to thank you for literally being a hero. Definitely.
We're trying. It's a team effort for sure. So
let's talk team effort. So on our end, how I feel like we can support you guys is I feel like we can take it seriously, right? We can stay indoors. There's no need for us to be congregating and not heeding it and not feeling like it's a reality. I know a lot of people have said that they feel like the media has blown it way out of proportion in terms of coverage. So I really just would like your opinion about what is the reality. Is this a serious situation? Is it blown far over proportion? What are your thoughts there?
I think the severity really depends on the location.
Okay.
I think one thing I was thinking about is that it's better to be proactive than reactive, right? I don't think it needs to be 5,000 people who die and then we're all reacting. It's okay. Hey, if we stay home for 3 weeks, 4 weeks, and that keeps the death rate low, then I think that makes more sense than to go on the reactive rate. So I think from a general public perspective, what we can do is to, again, like we said, social distance and staying home. And that, I know that it seems like things are blown out of proportion, but I think it in a way is good because even with things being blown out of proportion per se, people still aren't adhering to it. So could you imagine if everyone was just laissez-faire with what's going on? We would have more of like a social rebellion or what have you. So I think that in certain places it is, like in New York, where we have more than 50% of the cases in the country. So for us, as a state, it is just as bad as you hear on the news here. It may not be like that in the middle of Ohio. I'm not sure, but I know that cities like Seattle, Los Angeles is getting hit. Certain parts of Chester County in Pennsylvania, and so on and so forth, are starting to see more and more cases. So I think it's not blown out of proportion, but also in a way, I guess it is, people are panicking, and I don't think people should panic. I think people should just use social responsibility. And I think collectively that will help us keeping it from reaching this panic point that is being propagated throughout the media. But I think other countries have shown us what we don't necessarily want to live through.
Right.
What's going on in Italy is a nightmare. And it doesn't need to be replicated here, in its entirety. So I think it's just not trying to absorb the fear, but take away the key points of what can I do? Okay, let me work from home. Let me figure out this homeschooling thing. As hard as I know it is for parents, I empathize. Let me, do what I can to make the difference. And it goes a long way. So.
Brilliantly said. I want to talk about Italy for a moment because we're here in the U.S. and we've been able to sit back for a moment and look at these other countries and kind of see the areas where they could have used more support. And so for us back here at home, we're social distancing, we're isolating ourselves. But what happens when we go back? Okay, what happens when we go back to work and to school? Is there a worry? Is there a concern? So we're isolating now, but where is our peak? Like I say in
that is the part that honestly has me a little nervous, because if we're saying that New York's peak of critical cases coming into the hospital, or critical or peak of number of cases in the city state hasn't hit yet. We still have 2 to 3 weeks. Then that means that in that 2 to 3 weeks, we should still be socially isolated. And then even maybe a couple weeks after that, we probably should, because the spread is going to continue. So for me, I'm thinking the next 60 days, we should just bunker down.
Okay.
But I'm not an epidemiologist, So I'm hearing, our president is saying by Easter, that's only 2 weeks from now. So I don't know about that. So I'm just hoping that from the public health specialists, the scientists are really informing our administration and our government on what would be the best course of action in order to kind of get the country going again from an economic standpoint. But to me personally, I feel like it's better to be more conservative if it's going to help us in the long run. But I know there's been talks of, trying to balance the public health responsibility with the economic responsibility and having issues bridging the two. So
everything is happening at once. And I am so, I guess, impressed with where our technology is in terms of this telehealth that you kind of mentioned, where you're able to screen. What's that process like? Am I physically FaceTiming you? And am I talking to you over the phone? How does that work?
So for the company that I work for, it's basically if an employer calls in, I think, for a sick call or anything like that, they want them to be screened. And so we have a pretty vigorous questionnaire where we go through, have you traveled? Have you been in contact with someone who was positive? Have you been tested? What are your symptoms? How long have, we go through a series of questions that goes into this algorithm and and informs us whether that person can be deemed low risk or high risk. And based on that information, we send that information to their employer, and then the employer and the person on the phone, the client, they come up with the decision whether that person should return back to work. But we give them the full CDC recommendations. We tell them about social distancing. We talk to them about, if you develop these signs and symptoms, go to the emergency room, and we give them a nice script of information to help inform them and to also help to protect their loved ones. So the screening process is really just in place to kind of give employers a step one to see if those employees are able to go back to work, or do they need to consider giving them the opportunity to work from home, and that person should self-quarantine or socially isolate.
I love that you mentioned this earlier. You talked about us going to the grocery store, touching the vegetables or touching the card, and then that's transferred to someone who might be older or has a compromised immune system. When looking at the different patients and people that you've seen come into the hospital and tell you where they believe they contracted this from, has it just a mirage places, traveling?
People haven't, the patients I've come in contact with within the last 5 days, some of them are too critical to tell me. So that's first, they're intubated. Okay. But the ones who are alert and kind of on a more milder scale of the symptoms, they don't know. They don't know. My one patient wasn't sure if she got it from her husband or she gave it to her husband, or if her husband gave it to her mom, or they got it from her mom. Like, they're not sure. One thing I will say, the whole wearing gloves in public thing.
Okay.
I tell people, please don't wear gloves, because you're not sanitizing those gloves. So you're trying to protect your hands, but any germs that you pick up, you're transmitting to the doorknobs and to the fruit and the apple and all of that. It's better just to keep sanitizer with you at all times. If you touch a surface, you sanitize your hands. That keeps you from transmitting germs and stuff like that. So please, people, stop wearing gloves. It drives healthcare providers crazy.
I had some on today, but they didn't last long because I literally thought, well, these gloves are kind of now, so let me just discard them.
Well, some persons, like people who have coronavirus, who need to go out into the public, that's the person that needs to have on gloves and a mask, particularly that person, because they need to protect you from them. But in terms of just wearing gloves and then touching everything, it's like you're not helping. It's better just to sanitize your hands every time you touch something, and that helps to keep the transmission of any type of germs. But to your question, people kind of haven't been able to pinpoint it. They're just like, I just woke up and I had a fever.
Now, is it Is it true when it comes to the mask, there is a non-proper way to wear it? I'm not sure. I heard this the other day that wearing the mask improperly can lead to you contracting it.
So for the public, you know, I know N95 masks are important. It's crazy. I put out an SOS the other day trying to get people to send us N95 masks because
Okay.
we have
I mean, if you need,
in,
you put
in the hospital.
your Instagram here so people
Okay.
can find you. And if anybody's watching, what are some things that you need out there?
We need N95 masks, real ones, even the construction ones. I'm excited. I'm like, I see so many people with the construction ones on the street. I'm like, I need that.
And,
But so from the mask perspective, I'll speak from the hospital staff because it's kind of lay people. I'm not sure, you know, but from a hospital perspective, for us, N95 masks have to have a certain fit.
Okay.
Because we want to make sure that there's not a gap, because then it's like you have a mask on that has gaps. So everything you're trying to keep from going in goes in. Right. Okay. Right. So we do a fit test at the hospital during our employee health evaluations each year to make sure that we still are able to have the fit. So the commercial ones sold, I'm not sure how some of them work. Like even the construction one, I'm not sure how it works, but I know at least for the construction mask, it's very round. So some of the doctors in my hospital have been wearing it and they said it has a good fit for them. So it's supposed to have a good fit, a somewhat of a good seal to kind of help keep the particles from filtering in. Coronavirus is considered droplet. So it's like the flu. When you cough out, it suspends in the air up to 3 to 6 feet, and then it stays in the air for a little while. The time it stays in the air has been debated, so I won't say exactly, but it stays in the air for a little while, and then it drops to a surface. So that's how the contaminant. So if you go to a grocery store and you're positive and you're coughing all over apples, I like apples, coughing all over the apples, and you know somebody goes and touches that apple, even an hour later, boom, they've made contact with the virus. If they touch their nose, touch their eye, they've made contact. So I just keep telling people to, in terms of just try to take as many precautions as possible. But in terms of the masks, there's a fit that we have to be fitted for them. So
nice. So I know a lot of people are tuning in, and if you guys have any questions that you want to ask, this is so incredibly insightful because I mean there are so many new things and there's so much misinformation out there currently. So I really wanted to talk to you to be able to kind of put some minds to ease about what this virus is. And I know you and your staff, I know you guys are all still learning as you go, which probably might be one of the most challenging things that you guys have to deal with. So if you were going to leave people with just some sound advice, Yvonne asked, is it safe to go outside and exercise? Oof, that's a good one.
Hey, Yvonne. So I live in an area where it's actually pretty ghost town. So I tell people, you know, social distancing doesn't necessarily mean you have to stay in a box. You got to know your neighborhood. You got to know your area. Going to gyms, most gyms have been closed, which I think is a great idea. But, you know, if you're going to be at a distance from people, if you know that there's an area in your neighborhood or wherever where there's low traffic, you're not really going to come in to 3 to 6 feet contact with anybody. You want to jump rope or you want to run down your parkway, you know you're not going to bump elbows with anyone. I don't think it's the worst idea. Now, if everybody felt that way, then we could probably have a lot of people outside. So I think just use your discretion. You know your neighborhood. If it's 8 o'clock at night and it's safe to kind of, you know, take a run and you know it's not really going to be many people out there, that's safe. But I wouldn't suggest it from the perspective of putting yourself in a crowded space because it kind of defeats the purpose. But my roommate and I, you know, the other day, our area is very quiet. So we were able to jump rope out in front of our building and had no interaction with anyone else. So it was okay. What was the question?
I think it was Mario. Mario, was that you? So out here in the
Valley fever.
Yes, valley fever is something that we primarily see out here in the Central Valley where we're at. It's from like spores within the dust and dirt because we live in it gets very windy. And so you see a lot of people catching valley fever and you can die from it. So there's somebody that, is there any research about people that have valley fever, because that also affects, your breathing capability.
Yeah.
Also
Yeah.
respiratory. So in terms of coronavirus, that mixture just is not a good one.
That doesn't sound like a good one.
Yeah.
I'm not familiar with valley fever, but if it is, if you've contracted it before, maybe if it's been an issue for you before, I would probably say the person who has had issues with valley fever in the past should be on high alert. So that way, if monitoring your temperature, especially when you're at temperatures that are over 100.1 that aren't breaking, that's the time, go to the hospital.
Yeah.
Because if it's your Tylenol is not breaking the fever at home, there's no need for you to wait at home till your system is boiling. So if you've been predisposed to that before and you feel like you're at risk, just keeping a close eye on your symptoms or being in touch with your healthcare provider early on, just to let them know, hey, I'm so and so, I haven't seen you for a while for a wellness visit. Just want to put you on alert. I've had bad asthma last year, or I got valley fever last year. It was really bad. I just want your office to kind of know that I'm a little nervous, but I feel okay right now,
Yeah.
and then if symptoms develop, you can be on like a high alert for that office.
That's excellent. I'm glad you brought up asthma, because I know that's a main thing. A lot of people have asthma. I had asthma growing up and then kind of grew out of it. So that was a concern for me. I like Yvonne's next question. She asked about, can you not know that can you have it and be asymptomatic?
Absolutely.
That's
Absolutely. And that's the scary part about it. You can have
yeah.
it and you might have mild symptoms. I think mostly everybody who's coming to the hospital hasn't been completely asymptomatic. Of course, they've had some type of combination of symptoms. So I'm just trying to see, how do I get rid of this? Anyways, I'll leave it. So they've had some type of combination.
The questions.
I don't know. It's all right. So they've had some type of combination of symptoms, whether it's just as mild as feeling so lethargic, body aches, when you feel like you have a flu, if you've ever had the flu, because I've never had the flu, but just where your whole body is just aching and you feel very tired. That might be your only early symptom, and then it may progress to fever one day and you might resolve. I know several people who've had coronavirus who have been young, under 40, between 30 and 40, who have gotten it. They felt like they had the flu. They stayed at home unknowingly for a week and a half, didn't even know, and then they tested positive.
Wow.
And then I know some people, and then they quickly resolved. So it's really not easily pinpointed, because some people have had it very mild symptoms. They've resolved quickly, or some people haven't. They know that they're sick, and they progress to needing hospital care. So,
and that's the biggest reason why it's so important for us to be staying at home when we can and not really going out to visit our older relatives, or if people have preconceived, a precondition. For me, knowing that I'm still actively working and I'm still active in the field, doing stories and interacting with people, I have made the choice, not to go visit my grandmother over this time, because
right.
I don't even want to put her at risk. Mario asked, are you getting the supplies like the N95 mask and other protective equipment? So you mentioned that earlier.
Yes and no.
Okay.
Just briefly, yes and no. We are given a limited supply. We have a limited supply. And so we have a limited supply. So we are nervous, and we are praying for a re-up of supplies, because when you go in and out of the room so frequently, you use up supplies. And so as a way to kind of conserve what we have, we are reusing masks that we normally would use only once. And so that is putting us at risk, but it's, the price that we are paying as healthcare providers to try to take care of our patients. And so we're just praying that, within the next couple of weeks, we're going to get what we need. So when the surge hits New York, we're prepared for it.
Exactly. When it hits. And you know what? I'm definitely going to be praying, sending my prayers to you as you're out there on the field, working hard. And if you guys do know anyone with any of those extra masks, I know you'd asked if they could send them your way, or I'm sure if you know a local hospital that you could use some masks. Everybody is in need of masks right now with healthcare providers. So please keep in your local areas, wherever you guys are tuning in from. So if there are no other questions, if there's anything else that you'd like to leave with us, just, facts over fear. And
I think in the end, it is well. I think from a provider standpoint, like we said, you know, we are banding together in the hospital, and outside the hospital, we're just asking our fellow citizens to also band together with us, by just being as socially responsible as you can. A lot of us are feeling the weight of this, even if you're not in the hospital. So many people are affected economically. I know so many people who are laid off, who now are going through economic hardship. So we are affected. So the empathy is full circle. But we just, as a community, we just need to band together through this time. Keep sending the encouragements to the nurses, the doctors, the respiratory therapists, the environmental, you know, cleaners at the hospital, to everyone you know within the hospital system and the healthcare system as a whole. And then I'm just grateful for everyone who's keeping our grocery stores open and our banks open and our post office open. They're also making sacrifices and putting themselves at risk as well. So I think as a community, I am happy overall of what I have been seeing. And I just hope that those who kind of haven't gotten with the program will just start to take it seriously and join the ranks for a better mankind. So
exactly. And I honestly think, from seeing your face, hearing you tell your story and the things that you've gone through and the things that you're experiencing, it really helps put a face to the people that are on the front line. You know, when people are thinking about, should I, you know, go out and interact with a large
think
group,
of me.
I hope they I honestly do. And you know, running the risk of exposing you as well. So I hope you guys all take that into consideration, and we can all work together to get through this. I've never
Yeah.
seen anything like this, covered a story of anything this nature. And I'm talking to other medical professionals. It looks like this is something you guys were not expecting, or even you can see from the equipment or the lack thereof that, you know, the medical system was not prepared for this. So let's hope through sharing the knowledge that, you know, we'll be ready in the future if this were to ever happen.
Yeah. Well, thank you so much, Raina, just
Well,
even being on the front lines yourself, giving us up-to-date, accurate information. It's reporters like you that we need in our system. So again, it's a team effort.
So I want people to be able to follow you and find you. Okay, so can you let them know where to find you, Instagram name, and all that good stuff?
Nurse Idara. So that's nurse, and then IDARA. You can follow me. If you have any questions, feel free to DM me. I am still learning, but I am trying to stay actively informed to make sure I'm giving accurate information. So thank you all for tuning in. And thank you, Raina, for this opportunity. Oh, did we
pause?
Yes, it did pause.
Are we back?
Don't forget to save it.
We a call coming in. You gotta let me finish the live video before you call me. Nurse Idara, thank you so much for all that you do. I want to continue to keep in contact with you. Let me know, you know, with another down moment, you want to check in and give people some updates, because again, you know, we're in the middle of this and we're going to be watching this. If you guys have any more questions, you want to reach out to her, please feel free to do that. Please also follow and encourage her. If you guys know of anybody that has masks, you know, please reach out to her to be able to send that her way, and for the people that she works alongside. Okay. All right.
Thank you so much.
That's a wrap.
All right.
I'm going to end it, and I'll save it and figure out how to send you the video.
Okay, no problem. All right, great chatting with you. Good night, everyone.
Okay, stay safe. Okay. All right.